Hello, everyone. We'll give it just another minute before we get started. In the meantime, please introduce yourself in the chat box with your name, your organization, and where you are located today. And please be sure to select a language using the interpretation button at the bottom of the Zoom screen. Hello, everyone, and thank you for joining us today. We are excited to have you join us for the final roundtable on advocating for WASH in healthcare facilities. Please be sure to select a language using the button at the bottom of your screen. Apologies there. And as we get started, please introduce yourself in the chat box by sharing your name, your organization, and where you are currently located. I'm Danielle Heiberg, Advocacy Advisor with Global Water 2020, and I'm excited to have you join us for today's discussion on advocating for financing. We'll start the discussion with a short panel, followed by an open discussion so that you can share your own experiences, ask questions, and learn from each other. Before I turn the discussion over to the facilitators, a few logistics. The webinar is available in French, English, and Spanish. By now, you should have already selected your language using the button at the bottom of the Zoom screen. To help the translators, when speaking, please be sure not to speak too quickly. And from time to time, comments may be repeated in English to facilitate the translation. The webinar is being recorded and will be available in all 3 languages on Global Water 2020's YouTube channel later this week. Please use the chat box for comments, reactions, and questions. If you would like to speak during the open discussion portion of the session, you can also use the raise the hand function and wait to be called on. And now I would like to introduce the facilitators, Ellen Walter and Hank Habich, for today's discussion. Ellen Walter is an international advocacy expert at IRC, where she leads the international component of the Watershed Empowering Citizens Strategic Partnership. She has worked with the US government, as well as the private and nonprofit sectors, including as the Sustainability Director with WASH Advocates. Hank Habich is a principal with Global Water 2020, having served as a leader in many areas of environmental business and policy. His career in the environmental policy world has included leadership positions at the U.S. Environmental Protection Agency as Deputy Administrator and at the U.S. Department of Justice as Assistant Attorney General in charge of the Environment and Natural Resources Division. Hank has held numerous board seats over the years, and currently he serves as the Managing Director of the U.S. Water Partnership, Chairman of the Board of Water Health International, and serves on the board of the Global Water Challenge. And Ellen, and Hank, I turn it over to you.
Great. Well, thank you, Danielle, and welcome everybody. And let me just start by thanking Danielle and Haley Schramm, along with a lot of other people who designed and put these great roundtables together. And thanks to Ellen Walter, who is just a great advocate in this space and will help navigate this discussion today. So I'm just going to give a few opening remarks. This is today is all about you and getting your views and comparing views and seeing where we go from here in terms of advocating for funding. But let me just offer a few thoughts at the beginning and then speak as little as possible after that. We have a tough act to follow. We've had 2 outstanding roundtables already, but in many ways, those roundtable discussions led us to today. And let me frame the issue for today in the form of a statement of frustration, if you will, which I think all of us share. Thanks to the great advocacy of people on this call and many others of our colleagues, the awareness of the vital importance of WASH in healthcare facilities is really in many ways at an all-time high. Nobody argues about its importance. And we also, based on the global report that WHO and UNICEF came out with in December. We know that this gap in WASH and healthcare facilities is closable, and it's affordable in the scheme of things in terms of healthcare costs. So the frustration is, where's the funding? Where are the funding commitments? So today our discussion is about how do we elevate the importance of WASH at the national level and globally. How do we elevate the role of WASH in national budgets and in global funding? So this, as I say, this will be mostly an open discussion, but I just want to offer a few thoughts up front. As you can see in these definitions, and we'll just leave this up for a moment, first to clarify the kind of funding, and then I'll talk about sort of the geographic focus of funding. So first, we talk a lot about funding and financing, and in the banking community, bankers consider financing loans that need to be repaid. Funding is getting money to solve a problem generally, and so funding, and we had numbers have had a good discussion about this. Funding involves donations in addition to loans, and so when we're talking about WASH in healthcare facilities, particularly in the poorest countries, funding begins with donations, begins with grants, because many facilities are not ready to repay loans. Then we progress to what is called blended financing, which could be a combination of grants and financing. And our goal ultimately is to have such a well-established WASH sector that that facilities, healthcare facilities, and utilities can be financially self-sustaining. That's what it's all about. But as we talk today, a lot of the discussion will relate to donations, but we'll also, and we invite your comments about both donations as well as loans. So let me then just talk briefly and get this discussion started, but let me talk briefly about the theaters in which financing and funding occurs. First and foremost in the financial landscape is the national level. The focal point and the really important part of WASH and healthcare facilities is that success begins with national policy and budget commitments. It begins with the country, and if the country doesn't make commitments to WASH and acknowledge the importance of WASH in healthcare, it's very hard for other funders to come in and help solve the problem. But if the country makes a commitment to financing and funding WASH and healthcare facilities, that can open the door to other sources of funding. So we begin with the national level. The next level is the global level, and what you could call global finance. And there are a number of important institutions in the global financing space. The international finance institutions, the World Bank, the regional development banks. Now there's a growth of multi-donor trust funds and other large financing and funding institutions. Those are mobilized when countries set WASH as a priority. And then last but not least, there are local partnerships that many of you are involved in. So when we have the national commitment, we have the commitment of resources from the national and global level. That helps facilitate partnerships at the local level to actually implement sustainable WASH programs. And that implementation process is critical. And when those partnerships come together, other sources of funding can come in. Philanthropic funding, other sources of local funding, NGOs and others. So we have this landscape of funds. I think one conclusion to draw from this is that in our view, there is money, the money is out there to finance WASH and healthcare, to fund WASH and healthcare. The importance, the key is to get at the national level, to get that commitment in place, to have it acknowledged, because I think our frustration has always been that WASH has always fallen through the cracks. There are a lot of stovepipes there in the funding and financing and policy world. We need to acknowledge WASH's importance at the national level. Funding, we believe, will follow. So I guess the last point I would make to set the stage, and I'll turn it over to my colleague Ellen, and let's get on with the discussion, is there are three dimensions of advocacy, as you all know far better than I do. There's the global dimension, the national dimension, and the local dimension, as I mentioned, with regard to financing. We invite your comments on advocacy at all those levels. The primary focus of this discussion is how do we get at the national level, WASH elevated to the priority it needs to be and get it reflected into budgets and other funding commitments. So we have the right people to talk about that and figure out what the path forward is. So without further ado, let me hand over to my colleague who is one of the great WASH advocates, Ellen Walter. Ellen, over to you.
Great, thanks so much, Hank. Yeah, I'm really happy to be here and to see so many people online for this really great discussion. So we're going to start with a poll. We want to find out a little bit of information from all of you. We apologize, the question will go in the chat box in French and Spanish, but I'm also going to read the question out loud. So how engaged are you with technical ministries on budget tracking and financial flows? So please respond to the poll, and we'll, once we have the responses and the poll closes, we'll see where everyone stands on how much they're engaged with technical ministries. Great. Looks like we're seeing actually a relatively even number between how engaged people are. At the moment, the largest number at 33% is people who are partially engaged. Excellent. We're going to give it a little bit more time. Great. So we had about 25% that are not engaged at all. And we hope that during this process, you'll hear examples of how to get engaged to maybe increase and to identify the feasibility of engaging with technical ministries and even ministries of finance. We had 25% also who are not engaged but are starting to make connections. We had the highest percentage, which is great, at 36 for those who are partially engaged. And then we had 13%, which I think are our experts who are very engaged in budget tracking, financial flows, engaging with technical ministries and possibly with ministries of finance and other leadership related to Washington Healthcare Facility funding flows and budgets. So at this point, we want to turn over. We have a great panel of speakers to start off who are going to really build on the comments from Hank and talk about their experiences and shed some light on what we're talking about and set the stage for the roundtable. So our first speaker will be John Barrazo. He's a senior health specialist at the Global Financing Facility for Women, Children, and Adolescents, so the GFF, which is hosted by the World Bank. There, he focuses on maternal, newborn, and child health, as well as multi-sectoral issues affecting these outcomes. Prior to joining the GFF in October 2018, he was at USAID, the U.S. Agency for International Development, in various leadership and management roles over 26 years. He was working on environmental health, water supply, sanitation and hygiene, maternal and child health. He also recently served on the WHO UNICEF Lancet Commission, A Future for the World's Children. And our speaker after John will be Dr. Caterina Fonseca, who is an economist with over 23 years of experience in development cooperation and nonprofits, 20 of which in the water and sanitation sector. She's an associate of IRC and a senior advisor to Sanitation and Water for All. Her company, Pulsing Tide, provides technical assistance, training, and strategic advice to governments and organizations. So we're very excited to have them give you some insight and share their experiences as our kind of opening panel. So John, we'll turn over to you. Thank you so much.
Okay, well, thanks very much, Ellen, and thanks, Hank, and thanks also to the organizers that Hank has already thanked, but also thanks to Global Water 2020, not only for this roundtable series, but also for the sustained effort on this key issue over a period of years now. And I think it's a good example of how, sustained and focused attention in trying to continue to bring more and more diverse players and stakeholders into a discussion really can make a difference over time. So I just want to reflect that, and I thought it's been a very successful effort over the long term. I'm also honored to have been invited to provide some of these framing remarks, and Katerina and I, with the organizers, we agreed to take different angles on this framing. So I'm going to be talking more about the national level and the things that go on at national level, and what does that look like from at that level. And Katerina is going to look at more of the bottom up picture. How do we actually influence the national level by starting at the decentralized level? So, you heard in my background that I've worked across a number of different sectors that relate to this issue. And I'm quite sensitive to the fact that WASH and healthcare facilities is actually, it sounds so easy, but it's actually incredibly complex. It cuts across multiple sectors, from health service delivery to water supply, multiple levels of stakeholders from national to local, such as district level officials, to diverse stakeholders, including public sector, commercial private sector, and not-for-profit NGOs. When we look at this complexity, it's in turn reflected in diverse financing modalities. And usually, when I'm going to be using the term financing, it's not quite the banker's term, even though I work at the GFF. It's housed within the World Bank. And as my mother said when I told her I was joining the World Bank 2 years ago, said, "Well, what do you know about banking?" But the reality is that it's really more of a blended financing, where there's some component of it that's typically grant, some component of it that's typically loan. Even the World Bank, for the lowest income countries, actually increasingly makes grants, particularly for social sector issues. So there's a blended financing that we have to figure out how to best harness, in support of both the upfront costs, which can be significant, both not only in terms of hard infrastructure, but also soft infrastructure like human resource development, as well as the recurrent costs to help maintain adequate quality of WASH in healthcare facilities. In the previous roundtables, we've discussed the large gaps that exist in most low and lower middle income countries between our aspired standards for WASH and healthcare facilities and that reality on the ground. We've discussed the best approaches and platforms for advocacy and accountability at country level. We've talked about the ways in which WASH and healthcare facilities can relate to a number of endpoints. And I work primarily, as you've heard, in maternal and child health. It relates to maternal and newborn health. It relates to respectful care. It relates in general to the issues of infection, and ultimately to quality of care, which is a key issue in the health sector now. And today we're talking, as you've heard, about the most effective ways of translating all this success in raising awareness and in the success in gaining political commitment into sustainable country level financing for WASH and healthcare facilities. Now, we can't ignore the fact that we're in the middle of a challenging time, and this current COVID-19 pandemic, it really has highlighted the diverse systems weaknesses in health service delivery, in other systems as well. But in the health sector in particular, there's new attention being given to infection prevention and control in health facilities. And this presents both an opportunity and a challenge. On the one hand, it's impossible to talk about effective infection prevention and control without also considering deficits in WASH and healthcare facilities. But on the other hand, the competition for scarce resources, both from the domestic side as well as international sources, is intense, especially in light of the major financing requirements in the health sector that are COVID specific, such as vaccine procurement and deployment. For these reasons, it's really more important than ever to ensure the greatest efficiency in the use of available resources. So when we talk about the broad issue of financial support, whether it's financing in a banker sense or whether it's funding, I mean, the reality is efficiency is going to matter a lot. And being able to make that efficiency argument is going to be an important piece of advocating for funding and financing at that national level. And there's several dimensions to this. One is in terms of prioritizing the systems interventions that are most critical in maintaining essential services. That's a broad category. Aligning all sources of financing, domestic, international grants and loans around those agreed priorities, and ensuring that agreed priorities are executed well and with high impact. So it's so when you think set in that context, you're really got to be thinking about the ways in which we take an issue like WASH and healthcare facilities and make it relevant in terms of some of those arguments that it's the best use of money. And if applied to this issue, it can be used well and will achieve its outcomes. So again, some of the issues that we've discussed previously in this series around accountability and measurement, also come into play. The Global Financing Facility, as you've heard, it's housed within the World Bank. It was launched at the Financing for Development Conference in Addis Ababa in 2015, and it was designed to help close a very real financing gap between the aspiration of eliminating preventable maternal and child deaths by 2030, which is in the SDGs, and the reality of the funding that was actually going towards those issues. This 2015 is already, almost 6 years ago. The thinking, of course, continues to evolve. The way this is framed is within the context ultimately of strengthening primary health care on the road to universal health coverage. There is a bigger health financing picture that's out there, but it's not. But I'll come back to this in a moment. WASH in healthcare facilities is not just a health financing question; it's actually a broader financing question. For those of you who aren't familiar, and at the end I'll put the website address for the GFF in the chat stream. The GFF, it's country-led financing mechanism that unites domestic and global partners around a national plan that prioritizes and funds the most cost-effective and proven interventions. It's focused, as you heard, on women, children, and adolescents, and it's also designed to help build resilient and equitable health systems. And I think that the WASH and healthcare facilities agenda really fits very cleanly and well into that. So it's, in this sense, it's very much aligned with this vision for WASH and healthcare facilities that I outlined. The GFF is indeed within the World Bank, and that partnership with the World Bank has been critical, enabling the use of the relatively small amounts of GFF grant financing that are available at country level, and link these with the larger amounts of World Bank financing. And I know that in any discrete issue, I mean, the amount of funding that the GFF makes available as quote unquote small grants, which is usually, in the range of roughly $10 to $30 million in a country, sounds huge. But remember that the problems are that these grant funds are used to address in a catalytic way are very big problems, and they're not just confined to a single issue, typically within the health sector, but are trying to address broader and systemic bottlenecks. As of June 2020, the GFF had invested about $600 million in grants, linked to approximately $4.7 billion in World Bank loans and grants, with investments in 25 out of our current portfolio of 36 partner countries. And you'll be able to see some of this if you go to the website. In addition, the GFF's support in strengthening the multi-stakeholder country platforms is a key element of what the GFF does. These platforms are there to help develop a clear investment case for women's, children's, and adolescent health and nutrition, and that helps to align even larger volumes of domestic and external funding behind agreed, or funding and financing per Hank's definitions, behind agreed priorities. So where does financing for WASH and healthcare facilities fit in this GFF context? The GFF is not a global fund in the sense that there's an application that's made to a central funding pool reserved for key issues. such as the INFACT Global Fund for AIDS, TB, tuberculosis, and malaria. But rather it's relying on this country investment case, which I've already described, to help guide investment as part of a coordinated and aligned approach. And it also directly interfaces and leverages the World Bank's financing, and then indirectly, as I said, this larger group of stakeholders in an investment case. So if WASH in healthcare facilities is going to be prioritized in an investment case, it's important that the key stakeholders in this issue be part of the investment case preparation, and that they're bringing state-of-the-art information and cost-effective approaches and solutions into that conversation. And that has to inform a results framework that clearly articulates how the investment improving WASH in healthcare facilities will translate into tangible improvements in the health and well-being of women, children, and adolescents, and also support, as I said earlier, improved systems of primary and referral care, on the road to universal health coverage. In 2020, the GFF and the World Bank's Global Water Practice, and my colleague from the Water Practice could not attend today, but it's very much a partnership, have initiated a collaboration to support country stakeholders in bringing clear country-level definition to bear on required investments to improve WASH in healthcare facilities. A toolkit has been developed to both define key areas of investment, not just in the health sector, but other relevant sectors as well, to support both investment case preparation as well as implementation, as well as the preparation and implementation of related World Bank and GF co-financed activities. The diverse WASH in healthcare facilities domains covered in the toolkit range from an overarching situational analysis to proposed governance and financing arrangements based on policy analysis of political economy and the institutional setting, to human resources reform, such as the establishment of a professionalized health facility cleaner cadre, to the design and specification of needed WASH and healthcare waste management infrastructure investments. And I intentionally didn't start with infrastructure on that list. I think that we often think too soon sometimes that in WASH and healthcare facilities, that the first thing to address is an infrastructure gap. But indeed, sustainable solutions to this problem and sustainable financing of those solutions is really going to rely on systems thinking. I can recall, for example, a trip to Ethiopia 15 plus years ago now, where I visited healthcare facilities at the district level that were built to government standards. And they had a water storage tower in place, they had sinks in place, they had pour flush toilets installed, but they had no water supply. And none of these facilities, none of these WASH-related facilities in the health facility were working. So we have to look at how do we actually leverage and align financing from diverse sectors to ensure that we actually have sustainable solutions. Finally, I want to acknowledge that we are all living in challenging times, both personally and professionally. There are many COVID-related threats to these gains that we've made in the health over the past 2 decades, with disruptions to diverse health sector services, both outpatient and inpatient services. These impacts are varying over time and from place to place, but they're real and they can be large. The GFF itself has had to quickly pivot to help governments and local partners really understand what disruptions are occurring, track health expenditures and shifts of health expenditures, and prioritize and protect services that are at risk. Ensuring that the COVID-19 pandemic does not wipe out the hard-fought gains that have been made in women's and children's health, and help to continue the nascent progress we've had in addressing critical issues in adolescent health. It requires that support the countries in protecting essential services, making them more resilient to these stressors and improving their quality. This system strengthening with equity is this is both within the current COVID context, but also goes beyond it. And it's at the heart of our new GFF 2021 to 2025 strategy. It's my personal view that ensuring sustainable financing for improvements in WASH and healthcare facilities, this plays a critical role in the overall quality and resiliency of these health systems that are so important for maintaining these essential services. And the place to make this case for financing, with all the different arguments and considerations that I've outlined so far, is really to be made at the country level. So with that, I will turn it over to back to Ellen, and I think it's going to go over to Katerina. So look forward to our discussion. Thank you.
Great, thank you so much, John. We're going to turn over to Katerina. There was a question, so maybe in the chat you could provide some examples, John, about the mechanisms that are available to monitor WASH budgets at country or national levels. And I think Katerina might be giving some examples also around budget tracking. So Katerina, we're going to turn over to you. Thank you.
Thank you, Ellen. Good afternoon or good morning for many of you. It's a pleasure to be here. Thank you very much for inviting me. I think I'm going to start being a bit even more direct than John. And I start with a disclaimer based on 15 years of advocacy in the water sector. So advocating for increased funding for water is hard. Advocate for increased funding for sanitation is even harder. And then if you go into advocating for funding for water and sanitation in healthcare facilities, it becomes even more difficult. But what I want to tell you today is there's a couple of examples that we know that have been and approaches that really have been effective and have been working. Next slide, please. So I'm going to provide you with quite a couple of examples, and they are either in the SWA, so the Sanitation and Water for All manual for finance ministers. I'm only giving pictures because all the pictures and the slides have all the links for everything I'm saying. So then the organizers will share them with you, and you also have the links. So no PowerPoint, just pictures. So that's one, and here there's some in this, the manual for finance ministers, there's also some of the mechanisms used at national level by different type of organizations to track budgets for water and sanitation. And then specifically from the watershed, the IRC program that I have managed for the past 5 years, there's a discussion on 4 pathways for change through civil society, but this is not just civil society. This is also other stakeholders that want to influence either the national level, the district level, or the local level, and it explains the 4 pathways for change. So this said, I think looking at the big picture of advocacy for funding and where have been the most successful moments where we have seen a massive increase of funding for the water sector, which then trickle down also to the healthcare facilities, to education, has literally been when a head of state or equivalent has actually made it a top priority for the country. I mean, we have examples now from India with the Swasthbharat. In the past, we have South Korea, which has provided universal access to water and sanitation within 1 generation. Or more recently, we also have, for instance, the First Lady of Burkina Faso, which is really a strong advocate for hygiene and sanitation. When this happens, when there's really a priority set by heads of states, then there's less barriers among sectors, and there's higher cooperation between water, sanitation, health, education, for instance. But the other examples where I've seen very fast changes in budget allocations have actually been bottom up, and this is what I want to talk to you about. I want to show you how through capacity building of citizens group, of civil society organizations, of engaging with local governments, you can actually see very fast change. So I am going to basically I only have now probably 8 minutes, so I will only talk about 2 of the 4 pathways of change to influence increased funding. And the first one that I'm going to talk about is really engaging with both the district political and technical financial decisions. So not just the technical decisions, but also the political side of it. And for that, I'm going to give you an example from Bangladesh. Next slide, please. There's a little bit, someone has the microphone unmuted and there's a lot of noise in the background. If the organizers could please mute the participant. Thank you. All right, so the first example is from DORP in Bangladesh. And this organization really works with the grassroots civil society organizations. And when they don't exist, they really work with citizens representing the most marginalized. This is from Bola Apazila, and they have trained both the local government and the local marginalized groups in the budget process. Literally, what is the budget process? When the citizens can have a voice? When can they talk with the district level, both the technical side to influence and the political side of the decisions? How to make budget more transparent, and then how to increase them for those being left behind. They have, next please. They have really engaged with illiterate women from the poorest communities and most marginalized in Bangladesh, which are the nomadic fishermen. And in about a year, so this is in the picture, you see Conihor, the lady standing. It took a year to work with her and the women in her community for Conihor to feel confident. And this was the first time she stood up and actually participating in a local budget discussion in her own language. And the team was very, very proud. And that's why we also have a picture. On the left side, you see budget transparency. It's very, very detailed disaggregation. They also have, I don't have a picture, but they also have made a printed agenda with the budget process and the key elements for intervention of different stakeholders in those moments. So at the start of the month, you can see, well, these months you really need to be at this meeting that takes place in this date. But I think the most important have been the results, and budgets have increased every single fiscal year for the past 4 years. Because they were so successful with raising the budget for the district for water and sanitation in healthcare facilities as well. They have inspired other districts nearby and the CSOs that work there to do the same approach. They have been facilities built for the marginalized communities. And I think one of the most incredible things I've seen is they developed a very sophisticated, disaggregated gender and marginalized budgeting process. Next slide, please. So this is, you actually have the link to the full disaggregated. This is translated with a lot of detail. You don't need to read everything, but I just want to show you how it looks like on the left side, on the right side. You have the budget allocation for women, girls, the elderly, persons with disabilities, excluded groups. And on the left, you see the top is immediately healthcare and water, health service and water supply. So when these discussions on budgets take place at local level, some of these barriers between that we have in our water, sanitation, hygiene, education, health become a little bit more murky, and it's easier to work with. This also includes both construction, maintenance costs, and and you can find all of the details in the slides. So the other example I want to share with you, the other pathway, is something I don't think we do enough in the water sector, which is engaging directly with citizens. I have seen that many NGOs and CSOs, they tend to be more accountable upwards to government than downwards towards the citizens that they are supposed to represent. So how can you do this? How can you engage directly with citizens, especially with all the COVID restrictions? And by the way, this whole work with DORP in Bangladesh has also been done during COVID restrictions. It is possible. Next slide, please. So I'm going to give you an example. So how do you engage directly with citizens? And this is an example from Kenya. You can do this by training budget champions involving the media and grassroots organizations. This is the work of CESPAT in Kajiado County. So they have developed a WASH budget manual for other CSOs. They have engaged with a very popular radio at prime times for a whole week. They really discuss budget participation and what is the budget, how it's done. They have taken calls from the audience, and then the last day, they actually bring in government colleagues to discuss the issues that were brought in during the week. Here you can see the main DJ, also budget champion Victor Juma, and Abigail, also one of the community budget champions, and you can hear them. There's videos. These are stills from the videos below, and you can read more about how to go with this process. The thing is, you never know who's listening to this program, especially if they are local and at prime time, and you might be also influencing directly government, the politicians that are involved in the budget process, and inspire them to say, you know, it's COVID, health and hand washing is one of the primary target areas, but we still don't have safe water in some of our health facilities. And this might trigger the thinking of having allies with you in these budget influencing processes. This didn't happen only in Kenya. In Uganda, in Fort Portal, HEWASA use also the same methodology to influence successfully the budget processes. Next. Yes, this one. So I have many more examples. You can see a summary of them. This is a still from a video. It's 11-minute video from several countries, not just Bangladesh and Kenya. Also, you can find a lot of resources in the campaign page. And I think to close, I want to leave you with 5 key messages. So what do you need? You need to understand in detail the budget cycles and the timing for contributions, because if you miss the timing, you lose 1 year. Only the next year you can influence. And it's interesting. You might think you know what are those critical budget cycles, but I really advise you to invite someone from the Ministry of Finance or even from local governments, from the area where you work, to come and explain to you and your colleagues what is that process, and have a lot of clarity of how that process looks like. Then seek allies, both with CSOs and within local government, to support your influencing efforts in these official platforms. You need to get all the evidence you can get your hands on. You need to be very, very specific what you're asking for. How much money is available? How much is needed? How much was it not spent last year and why? So you need to be very well prepared for some of these meetings. Use radio programs to reach broader audience base, and this also works with COVID restrictions, or find other ways that you engage directly with the broader group of citizens and not just with organized civil society organizations, because in many places, especially the most marginalized, citizens are not organized in any form. I will go to elderly groups or religious groups, find where there are entry points to a broader base of citizens. Then the very important, linking with what John started with, bring this experience to the national level platform, so you inspire other CSOs and you inspire local governments as well. We've seen this happening in a couple of countries. But my final message, given also the audience that is on the call, is that I don't know if you are aware, I'm sure you probably are, but civic space is closing all around us. Every year, there's a Civicus report, and they're just showing there's more and more restrictions for citizens to get organized, and we're talking about dialogue with governments, but these spaces are getting more and more restricted. They're not able to speak up and to claim basically their human rights. And at the same time, so not only is civic space closing, but at the same time, the funding for CSOs is decreasing, and is decreasing in sectors that promote democratic processes. And in the water sector, to my knowledge, there's literally a handful of programs funding direct CSO engagement. I know them all, that you can count them with one hand. It's very, very scary, actually, because the support always comes from government trickling down, but you're forgetting sometimes in our own organizations that you can see very fast change. And it's not community by community. Some of these districts that we are able to influence budgets are very, very large, and you can see change happening very, very fast. So final message, don't forget to support local citizens groups in any way you can. Thank you so much. If you need more information, feel free to contact me. I think the next slide has my email. Yes. And I look forward to be part of the discussion. Thank you.
Great. Thank you so much, Katarina. That was, and to John again for a great introductory kind of remarks. And At this point, if you have any questions specifically for Katerina or John, please type them in the chat, and we'll incorporate those into the first part of the discussion that we're having for the roundtable. So at this point, I want to turn back over to Hank to take us into the next phase of our roundtable here. Thanks, Hank.
Thanks, Ellen, and thanks so much to John and Katerina. I mean, we couldn't have two better speakers to set the stage for us, because you gave us both the global and the local perspective, the big money and the local citizen, and how those all need to be woven together to make this all work. Now we're going to transition. I do have, there are a couple of questions that I think we can work into the discussion coming up, because we want to leave the rest of our time to open the floor to all of you to talk about anything you want to talk about, but particularly given the inspiration that we've just had, talk about what's worked in your experience, what hasn't worked, or what you need, where you see gaps and where you see needs that can be filled in order for you to be more successful to work at both the grassroots and the national level, and talk about some, so we can start to formulate some paths forward. Before we do that, I think we have another poll question, if we're ready to put up one more poll question. So I'll read this, and we do have all the languages. So when you have engaged in advocacy for WASH, who've been your primary targets? The health ministry, water ministry, finance ministry, regional governments, or other? So it's quite a few choices, but it'll be interesting to see what your primary focus has been. And when we get into the discussion, it'll be interesting to see how much you've been able to get ministries to actually talk to each other and work together, because in our experience, even in the United States, getting different ministries to actually talk to each other and compare notes is not easy. So we'll just give it a little bit more time here. So what's really, go ahead.
Sorry, really quick, I just want to interject for just one moment. I know that one person at least is having problem with the Spanish translation. Others who are listening to Spanish, can you just type in the chat if you are also having issues with Spanish translation, or if it's just a singular issue? Sorry, Hank, to interrupt. Back to you.
That's very important. I was just saying, I've noted one of the things that's striking here is the small number of finance ministry, and that's not really surprising, but it's an important point for us all to focus on. So clearly, I think we can wrap up the poll. So just to take a quick look here, so more than half have had the health ministry as their primary focus. Water ministry is a third. Only 10% finance ministry, a third at the regional level, and then the rest is other. So we'll want to get some clarification of that coming out in our discussion. But thanks for that. So let's see. So we would like to open up the floor. I thought, what we want to do is get some perspectives from all of you again about what's working, what's not working, and we'll have some questions to pose to you as well. But let's. We had. I saw one comment in the chat. I just want to note here, and if Dr. Gonzani wants to add anything to it, that would be great. But I think I've made a very important point, which gets to this issue of the connection between the health, water, and finance ministries, that the strongest arguments for WASH and healthcare relates to the benefits that it delivers in terms of healthcare results. It isn't just, it isn't, quote, just having cleaner hospitals, but it has results in improving healthcare results across a spectrum of issues related to antimicrobial resistance, IPC, maternal and child health, and pandemic prevention, and so forth. And so being able to articulate that is very important. So John, I think you have your hand raised.
Yes, thanks, Hank. I just want to respond to a couple of the issues that were raised in the chat. So I think the point that was made by Steve Werner about the need to better articulate and be clear about a return on investment, I think that this is something that it's not necessarily a WASH and healthcare facilities specific argument. As was noted also in the chat, WASH and healthcare facilities relates to diverse important endpoints that are of interest to a Ministry of Health, whether the infection prevention and control broadly, as I mentioned, but also related issues such as antimicrobial resistance. But I think here the essential point is that the Ministry of Finance, the Ministry of Health will get very much on board saying, yes, this is an important issue. But it's the Ministry of Finance, if you're looking at domestic resources, that would have to get on board and saying, this is something we need to spend money on compared to, I don't know, ports or transport or electricity. There's so many different, so many different competing sectors for very limited resources. So being able to, I think we all have collectively to do more work on clearly articulating that economic return on investment. And there may be some better sensitivity to that now, given the economic impacts that we've seen of a public health crisis like COVID-19. So I think there is more work to do in that area, and I think it's an important point. Thanks.
Yes, and thank you, John. And let me just pick up on that point, and then after, I'd like to just pose the question related to this to Dr. Aminu Garba, who's with us and who runs the Africa Health Budget Network. So he's very much in tune with how to reach finance ministry. So Aminu, I'm going to turn it over to you. And then I know we have hands raised from Katerina and Zakaria, who was talking about the health argument. So we'll come back to those right after we hear a couple of minutes from Aminu about, reaching the finance ministries and the people in charge of budgets. Over to you, Aminu.
Thank you very much, Hank. I hope you can hear me well.
Yes, we can.
Yes.
Thank you.
Okay, so this is a very interesting discussion about the financing for the WASH in healthcare facility. And, listening to John Barroso, he mentioned two important points at the country level. The issue of the multi-stakeholder, country stakeholder coordination platform. This is a platform that if we are going to do advocacy for WASH in healthcare facility, we also need to key into that multi-stakeholder platform discussion. The Ministry of Finance, the Ministry of Water Resources, the Ministry of Environment, the Ministry of Health, and all the relevant government agencies at a country level, they can actually meet at the level of a country multi-stakeholder coordination platform and galvanize action for the WASH in healthcare facility. I want to inform the civil society group and advocates in this meeting that when you look at the country budget, at country, like for example, in Nigeria, in Liberia, in Kenya, in Sierra Leone, in any other African country, the WASH in healthcare facility budget is scattered all over the place. It is not in one place.
That's a dramatic point to pause on.
Yeah, I think we may have lost connection there, but if Aminu comes back, then maybe we can have him come back to the discussion.
Great. Well, so Aminu will come back to you, but Katerina, you had your hand up, and then Dr. Gantani.
Thank you, Hank. I wanted to reply to, I think the comment is from Joyce Cortland, and Joyce mentions that the need to hear a little bit more about the leadership within ministries of finance, and I wonder how you have established relationship with ministers of finance and what factors were key in convincing them. Could you elaborate a little bit on this? So in my experience of bringing the water and sanitation sector closer to the finance sector. For SWA, I have been organizing quite a couple of meetings in countries between the Secretaries of State of Finance and Water and Sanitation, and it has been very interesting because basically the Secretaries of State for Finance and for budget processes, they follow.
Yeah, Minu, just you pause for a second. Katerina's just finishing an answer, and then glad we have you back. We'll come back to you.
So, so what matters is the Secretary of State or the person in charge of the budget process is mainly following the 3 top priorities that have been set by heads of state. So that's one. And water is usually not, or sanitation or health is not one of them. And then the remaining discussions are really dependent on the ability of the 3 sectors, so water, sanitation, health, to put their case forward. And many times the water sector tends to put their case forward as a project. So everything that comes from the water, and I've seen this in at least 13 meetings that I had with different country governments. So the projects that are brought forward are not, this is what we need to reach this coverage for water, sanitation, hygiene, washing in schools, washing healthcare facilities. No, it's a project. This is the next wastewater treatment plant that we want to implement in this area. So we come back to this systems approach that we're looking still, when the water sector is talking about budgets with Ministry of Finance, is still very much narrowed down into this infrastructure approach. So that's one. One thing that I've seen where actually the Ministry of Finance is more open to the arguments from the subsectors is when in the multi-stakeholder platforms, there is actually a representative of the Ministry of Finance to the subsectors. So within the donor meetings, within the sector meetings in a country, there's a representative from the Ministry of Finance directly into sector meetings. Without, in the countries where there's no one, that link will be very, very hard to manage. I've seen this a lot, especially in the Francophone African countries. There's a very strong representatives of Ministry of Finance. Where they are not there, it's very hard to go through influencing the whole budgeting process. Over.
One point that comes from that, and then Aminu, back to you to wrap up, is when you only talk about hard infrastructure, it leads to one channel of thinking. And to talk about the whole picture of a sustainable wash program that includes all the human costs and O&M and that sort of thing, engages the health sector much more than just talking about sinks and toilets. But we'll come back to that. Back to you, Aminu. Hopefully we've got your connection back.
Yes, thank you, Hank, for bringing me back. Sorry, I lost connection. So I think I don't have too much time. I know it's just 5 minutes. So let me quickly mention that I want the advocates and the civil society in this meeting to understand that for us to do budget advocacy for the WASH in healthcare facility, we need to understand the landscape at the country level very well. So for example, I was mentioning that you will find money of WASH in Ministry of Water Resources. You will also find WASH funding of budget in the Ministry of Environment. You also find some money in the Ministry of Health. And of course, also within the Ministry of Health, there are some agencies of the government, like the Primary Healthcare Development Agency, and maybe some healthcare trust fund. All of them are going to be allocating money for WASH in healthcare facility. What it means is that we need to understand the landscape at country level very well for us to meaningfully engage and also advocate. One of the successes we had in Nigeria, just to inform the meeting, is the country multi-stakeholder platform, where the Africa Health Budget Network worked with a lot of civil society and the government agency to organize the platform. And today, the Ministry of Water Resources are invited to be a member of the multi-stakeholder platform, and also the Ministry of Finance is also having a rep in that platform. What does that mean? It means that at the level of that country platform, the Health Ministry, the Ministry of Finance, the Ministry of Environment, the Water Resources, they can all work together to organize and galvanize a harmonized budget for WASH in healthcare facility, and also ensure that annually the parliamentarians allocate a budget line, for the WASH in healthcare facility and a lot of other programs of the WASH. And the last point I want to also make again, I'm sure we're aware that in December, the Partnership for Maternal, Newborn and Child Health based in Geneva organized a global summit called the Life in the Balance. And in that summit, about 4 countries globally, they have made a powerful commitment for WASH in healthcare facility: Afghanistan, Liberia, Nigeria, United Kingdom, and the United States. Now, these are global commitments. At the same time, they are country commitment, because we need to come back to the country to engage these country leaders to ensure that what they commit at the global level is released, is disbursed into provision of water, hygiene, and sanitation at the healthcare facility level. So in summary, we all need to understand the country landscape very well before we can become a better advocate for WASH. And we're happy to continue to answer your question on the chat box, or whenever Hank would like me to come back again, I'll be willing to provide more input. Thank you very much, Hank, for the opportunity. Thank you.
Hank, you're muted at the moment.
Got it. Thanks so much, Aminu. And we look forward to learning more about the Nigeria platform. I think it'll be great for you to share that. We can share that with people going forward. Dr. Ganzani, you had some interesting comments. Please, the floor is yours.
Merci beaucoup. Merci à tous.
Thank you everyone. I think that this is something unusual, the question of WASH in the healthcare facility. There's a lot to do. The interpreter cannot hear the speaker well. I'm based in Burkina Faso. When we talk about WASH, we're talking about organizations that are involved in this type of service. We're specifically in health facilities. And most of the interventions are focalized on the WASH community. So for the health facilities, there's very little money. One of the solutions, you have on the interpreter has trouble hearing the speaker. So it involves so if you talk about access to water in health facilities in
Yes. Can you hear me? Yes, we can hear you. Hopefully we're getting translated.
Okay.
I think we're having some difficulty, Dr. Ganse, hearing you. So if you could type your, maybe your comments a bit more in the chat. The interpreter and others are having difficulty hearing you, and we want to make sure that we get everything that you're saying.
Thank you. I see.
Great. There was.
Go ahead, Ellen.
There was a question that Garant Upam wanted to ask. So I'm going to, if you have the ability to unmute yourself to ask that question. And then we have a couple of other comments and individuals that we want to hear from. So go ahead, Garant.
Hello, everybody. I'm sorry, I didn't set my camera. I didn't know I could set it on. I'm with the AMR think tank in Geneva, and I've been 8 years with the World Alliance Against Antibiotic Resistance. And we see a very, very close link between AMR and WASH. This was already pointed out by Lord Jim O'Neill in the AMR review supported by the Wellcome Trust and the UK government, because access to water would tremendously reduce the use of antibiotics in all developing countries. The study's been done in Nigeria and Brazil, elsewhere. And we as a think tank, we've been advocating to link up WASH investment in water with AMR, because we know even in well-developed countries that AMR is a problem of nosocomial AMR, in other words, drug-resistant infections being spread in healthcare. We have the same problem with COVID-19 being spread in healthcare, from what I see in the international scientific literature this morning, with 44% of cases being spread in healthcare. So to link up IPC cannot be done without WASH. And so effectively, AMR cannot be controlled unless we have massive investment in water. And that's been my argument. And I know USAID sort of shares that viewpoint, how essential it is. So my desire, and I would like your comment on it, is how can we link up the two issues? Because AMR is a big issue. We know it's going to mean tens of millions of deaths. And so if we say we need WASH implementation to cut down AMR, I think it would be one way to progress on the issue. Thank you.
Thank you. So I think Wibla has been able to join us, and would love to get your comments as such an effective advocate yourself, if you are, if you're still with us.
I'm French American, and I could translate for anyone if need be.
Thank you. Okay, we'll come back. I thought Wibla had joined us, but we can come back. I also saw. Oh, hi.
Hi. Sorry about that.
No problem.
Good morning. Good afternoon, everyone.
Thanks for joining us.
Thank you. Okay, so I could go right into my presentation.
Good morning. This is Arvind Fukon, past district governor and past director of WashRag from Tacoma, Washington, Rotary Club of Tacoma number 8. Glad to be here.
Thank you.
To join your group.
We appreciate the work you're doing. So yes, Wibla, if you have a couple of minutes to share with us based on your experience, that would be great.
Okay. Our experience with regards to the financing work for WASH, particularly coming from 2020 to 2021. For 2020, we were very deliberate in terms of our advocacy around financing. We kind of termed it a do or die year for civil society for WASH, especially with the economic issues going on in Zambia. We have a huge debt burden, and so we felt that it was very necessary to kind of speak to the government around prioritizing specific sectors and also prioritizing the limited resources that the nation is grappling with. So we made a huge number of submissions last year. Some of them were targeted around COVID, giving relief to commercial utilities, This particular intervention, we targeted the Ministry of Finance. And then to follow that, we made another submission again to the Ministry of Finance around tax and non-proposals for the 2021 national budget. Following that, we had several radio discussions on local radio just to raise public awareness around to discuss financing and why it was important. We used international commemoration events to engage with national leaders. I know at the Global Hand Washing Day, we kind of ambushed the Minister of Water then, and Dr. Chanda, to kind of ask him to be our wash advocate in Parliament during parliamentary debates. Following that, he allowed us to pay a courtesy call on him, and we were able to share in depth some of our frustrations and also the opportunities that we felt we could make with the Ministry of Water in championing the ministry's cause with the Ministry of Finance. And I'm happy to say that following that meeting, the Ministry of Water has since better engaged with the Ministry of Finance. We were able to kind of contribute to building a bridge between the two ministries, and there've been better interministerial discussions around prioritizing water and sanitation. Following our submissions, we also met with parliamentarians also to discuss with a committee that sits on financing, a budget committee, as well as MPs that come from areas or constituencies that are deemed cholera hotspots. They did appreciate some of the information that we were giving and said that it would contribute to stimulating parliamentary debate as regards to the budget. They would be able to challenge where necessary, where they felt that certain other items in the national budget, which could be financed at a later stage, would rather be put aside and allow for water to then take a center stage. Now, following that discussion, the national budget did come out, and then there was a 17% decrease in financing. And it was almost as if we were not in a pandemic, and somehow the budget failed to take note of the fact, to make the linkage between water and hygiene and all those things. And following that, we put in another submission that we called missed opportunity. And we put in a press statement as well to kind of express our displeasure, but also to kind of state what we felt could be the possible opportunities for us to better collaborate. Some of the things we thought was we have a number of green taxes that we thought could be used to finance water and sanitation projects, whether it's washing healthcare facilities, washing schools, that sort of thing. Added to that, we also felt that the government didn't finance the multi-sector cholera elimination plan, which is, as you know, Zambia has committed to eliminating cholera by 2025, and also that was something that we felt was neglected. But following that, we have been able to contribute to a number of other parliamentary interventions around making suggestions around improving governance within commercial utilities, because while on one end we're calling for better financing, we felt that there was a huge governance issue within the sector that still needs to be addressed. So we made submissions on that as well. And then added to that, we also made a submission to Parliament this year on Zambia's ability to respond to emerging pandemics, such as COVID, and also how the government needs to finance health budgets a little bit better, because currently the debt is larger than the health budget, just as an example. Tomorrow, coincidentally, we secured an appointment with the new Minister of Water. Unfortunately for us, after making quite a lot of traction, the Minister of Water was then transferred to the Ministry of Health. But we're very excited because now we have a wash advocate in the health ministry, and health is quite a big giant in Zambia, and we're looking forward to engaging with the new health minister, who was once the Minister of Water, and taking advantage of that. And then tomorrow we're meeting with the new Water Ministry just to kind of engage with him and also bring him up to speed with some of the good work that we've been doing, and also how we can better collaborate with the minister, the Ministry of Water. Going forward, I think one of the challenges that we face is grassroots engagement. I think one challenge is we're not able to tell how much of the grassroots input into national financing, how much they actually have an influence. On paper, ideally, it's supposed to be a bottom-up approach, but we don't know how much, whether this process is largely driven by national development plans, or whether that, the little Bubala sitting in a small district actually has a say in the national financing of the WASH budget that goes into the area. And I think that's something that we will look at exploring. We also want to explore doing a political economy analysis within the Ministry of Finance to kind of understand who actually has the power to finance water and sanitation, because we've made a lot of submissions. So we'd like to understand where the power lies and see how we can best harness it to kind of achieve our SDG targets and also our national targets. So those few words, I will end here. Thank you, Hank.
Thank you so much. Go ahead, Hank.
Over to you, Ellen. I think you had a question that you were going to address.
Yes, well, so a couple of things. If anyone speaks French or Spanish, if you speak if someone is speaking in French or Spanish, and you haven't selected a language, if you speak English, in order to hear what is being translated, you need to make sure that you choose English in the interpretation block. So just as a reminder to everyone, if you haven't done that already. So there's a lot of questions and comments. And so one thing I think just to highlight, I think the high-level political engagement that Wubala was just talking about, I think is really interesting. So if anyone has other examples from their experiences, please put them also in the chat or raise your hand. And then there was a series of questions and comments around coordination. So again, I would ask the participants if there's any examples that you have on ways that you've seen improvements in coordination between the different ministries that are involved, including the Ministry of Finance. And the last point that I wanted to raise before we get into the next comment is about that follows on to what Wubala was just saying, which is around power and control. It's important, and this goes back to what Katerina mentioned in the beginning, is that it's important to understand who holds power, where does that power sit? So understanding the system that exists so that you know where is the most effective way to interject. And the roles and responsibilities of a Ministry of Finance is very different. The approach you would take with them is very different than, for example, a Ministry of Health or Ministry of Water and Sanitation or another technical ministry. So just a couple of points highlighted from the discussion and what we're seeing in the chat. There is a comment from Abdullah Rabdo. And so I'm talking about basic services in Burkina Faso in healthcare facilities, particularly during COVID. So Abdullah, if you would like to expand on your experience from Burkina, that would be great. If you have the ability to open your microphone, please do that now.
Oui, allô? J'espère que vous m'entendez.
Hello, I hope you can hear me. Okay.
Yes, we can hear you.
Thank you very much.
Thank you very much. I will speak in French. So Our organization, AGVA in Burkina Faso, has partners for implementation of their activities in Burkina and worldwide. Here in Burkina, we had a study with some partners that we did, and I hope they will be able to share this study with all the other players in terms of WASH. But what we've noticed that we can say until those results are made available is that in the health establishments, what we've noticed is that the basic services are often non-accessible in health facilities. So you can get to a health establishment, and the access to water itself for the medical personnel and the population who comes, there's either difficulty in getting the water from the installations, or the access to water is too far for these people. And often there's some health establishments in terms of sanitation, all of their equipment or part of the equipment doesn't work. So that's what we've observed. And we often ask the question, what is the link between the water ministry and health ministry in terms of access to WASH? So I think there's the necessity for some synergy between these two ministers, or see what's going on and how the Minister of Water can help, or even economy and finance, how they can contribute to improve these equipment in the health establishment, especially now with COVID, where every day we are saying that we have to make water available for the population so that they can wash their hands, or wash their hands at all time. So I think the water minister and health minister have to talk about how to prioritize the efforts, and other partners that are involved in my country, how they can join their efforts to accompany those health establishments. Thank you.
Great, thank you so much. Hank, over to you.
Yeah, so we probably have time to just talk about a couple of additional interventions, and then we'll need to wrap up, but this is really just the beginning of a dialogue and follow-up, which we'll talk about before we wrap up here. There was, so Jacqueline Amangan. Jacqueline, if you have a brief question, it would be great to hear from you. Can you unmute your mic, Jacqueline? Yes.
Okay, can you hear me?
Yes. Thank you.
Hello?
Yes, we can hear you.
Okay, so my name is Jacqueline Amongi. I'm a member of parliament, and I've been championing WASH legislations and also budgeting and financing in parliament with the different colleagues, members of parliament, not only in Uganda, but also in other African countries. But in terms of financing, and like the presenters and many other members have spoken about financing for WASH, I really appreciate the discussions of engagement of citizens, but it would be very imperative that we take a recommendation on the engagement of the political actors, especially that the parliament speak on behalf of the people, and especially that the line ministries that we're talking about, Ministry of Finance, ministries that are relevant to WASH in healthcare facilities. I'll talk about the Ministry of Health I'll talk about the Ministry of Education. All those ministries cannot present their budgets and policy statements in Parliament, and their budgets are approved by Parliament. So what we, in the Ugandan context, what we do is we have had to engage with the civil society, especially in Uganda, to ensure that our interests and our concern in regards to financing for WASH is at the center stage of the debates in Parliament. So from our discussion here, I would like us to engage more, to look at how we can critically engage at the center stage. If you are dealing with the think tanks in the civil society and the media, what is it that we want parliamentarians to do in the Parliament in terms of appropriating for WASH? It's very important. So my suggestion is, how do we engage the political actors at different levels? I will give you an example of Uganda. We have gone ahead as members of Parliament because advocacy and budget allocation is also done at the local governments. In other countries like Kenya, in Zambia, they have regional government to influence the political actors in those regional governments so that they prioritize WASH in their local budgets. By the time it comes to Parliament, the champions within parliaments are playing their role. So whereas we're talking about engagement at the different level, including the line ministries, I think it's important. Hello?
Yes, we can hear you. If others would mute, that would be great.
As I conclude, I would like us to recommend engagements with parliaments being very critical, because at the end of it all, Parliament has the mandate to even reallocate. In countries where we have a parliament and a senate, Parliament plays still a critical role in rearranging resources. And for us as champions of WASH in Uganda, our interest is always to see how much has been placed to WASH, how do we engage with the different stakeholders within WASH, how do we bring the different line ministries working on WASH together. And as a Parliament of Uganda, we have all actually harmonized WASH activities, because when we're talking about water, you remember you're talking about water in the water sector, we're talking about water in healthcare facilities, we're talking about WASH in education, we're talking about WASH in communities. So we are like, how do we have this as a coordinated effort? And as a parliament, we influenced through the SWA, one of the recommendations that was made by our ministers during the sanitation and water for all high-level commitments. We said, okay, for Uganda's case, if we must take these commitments further, and if we must achieve the financing for water, we need to have a coordinated approach on issues of water, sanitation, and hygiene. And we formed the lead of government in Uganda, coordinates the WASH despite the different ministries implementing the activities of WASH in their relevant ministries. So in a nutshell, I would like to emphasize that as a WASH parliament, we are seeing that we are playing our role as legislators and as representatives of the people. And we are always proud to engage with the civil society organizations, because they also help us on advocacy, but also keeping us abreast with the issues that we need to raise in the parliament, either during debates, motions. Like tomorrow, we are celebrating the Sanitation Week in Uganda. And as members of parliament, we are going to demonstrate that, but we are also going to debate a motion in the parliament that if we're talking about celebrating Sanitation Week, what is it? We're talking about COVID, post-COVID engagements, and sanitation in healthcare facilities. Are we there? So that's what I wanted to include in regards to talking about financing for WASH. Thank you so much.
Thank you. Thank you so much. And it's an honor to have a member of parliament and to get your perspective. It's very valuable. And I think that's a good wrap-up comment. We have a lot of other great questions and comments, and unfortunately, we're just about out of time. We want to wrap up and talk about where we go from here, and I'll just spend a minute on that and ask Ellen for any final comments. But this discussion's been just fantastic. There were two other points that I just want to mention, and we'll follow up on those. You know, there were a couple of questions and comments about return on investment for WASH and healthcare facilities. And that's, you know, it's very important to be able to describe the benefits of investing in WASH, or put another way, the cost of not investing in WASH and healthcare facilities. And so, you know, you all are very important to provide the stories, the anecdotes, and the analysis is continuing. And I noticed that Guy Hutton is on. I won't put Guy on the spot, but Guy Hutton, many of you know, is one of the world's experts and one of the leaders in developing sort of benefits analysis of investing in WASH. And there's a lot of work that continues to go on with that, but there are a lot of examples of the benefits that WASH brings. The second point was the private sector. We didn't get a chance to get into private sector service providers like cleaners and people who perform O&M, but there's a lot of opportunity separately to invest in private sector entities that can provide the services for WASH. So more to come on that. Well, it would be a fool's errand to try to summarize everything that we've heard. I think our speakers have just been fantastic in providing perspective. Let me just offer a few notes that I made that are particularly important for follow-up. First, we know that there's competition for money at the national level. We know that budgets for WASH are scattered all over multiple ministries and line items and budgets, and we need to be aware of that and work on that. Second, we need, when we talk about investing in WASH, we need to talk about both the hard costs and the soft costs. Never just talk about the infrastructure by itself, the hardware and that sort of thing, but talk about the whole picture of a fully implemented sustainable WASH program that is sustainable over multiple years. And that highlights much more clearly the connection to healthcare objectives. Third, that this is a national and very much a grassroots level effort. We need to connect the national and the grassroots as effectively as possible, and that depends on understanding how systems work in individual countries. But Madam Amongin, who we heard from Parliament in Uganda, had some great observations about that, as did Katerina. National platforms. So we've heard about national platforms. We've got what Aminu, Dr. Garba talked about in Nigeria. There are other examples of harmonization. I think harmonization is a key word. In Uganda, we had an example in the chat box about how there's a water desk at the finance ministry, and we heard about Wubala's great efforts at collaboration in Zambia, and I know John Barrazo is working in Zambia to integrate WASH into those national plans. So harmonization and having national platforms where this harmonization can occur is key. Understanding the budget dynamics and how it works and the timing of budgets is so critical. And the most important harmonization, one of the most important harmonization points is getting the healthcare sector to embrace the value of WASH and be outspoken about it, in addition to the advocates for WASH. So we will have, I'll stop here, we'll have a lot of follow-up. We see there's a need to create a community of practice around advocacy for funding, provide information about the basics, about success stories, about successful arguments, and what works, and more to come on that. But thanks to everybody for your great participation, and the Global Water 2020 team for pulling this together. Ellen, I'll pass over to you for your thoughts.
Great, thanks so much, Hank. I don't have a whole lot that I want to add. I think you covered a lot of the highlights that I heard from the discussion. The one thing I wanted to pick up on was about expanding beyond some of the technical ministries into Parliament, into ministries of finance. I know in that survey that we had about who you're targeting, the Ministry of Finance was relatively low as a target you could engage, and I know that there will be follow-up with even more examples. So at this point, I don't, since we're out of time, I want to turn back to Danielle and just say thank you so much, both to the coordination team, but also to our presenters and everyone who is on the call today. So Danielle, over to you.
Great, thank you. And thank you to everyone who participated today, as well as all of our great speakers, John, Katerina, and also to Hank and Ellen. I know we're a few minutes over, but just a few closing notes. We will send out a follow-up email with the link to the recordings, and we hope that you'll share these with your colleagues who maybe did not have an opportunity to participate today. And we will also send out some of the links and materials that were referenced throughout the discussion. We hope you enjoyed this series of discussions. Unfortunately, this is the last one, but we hope that this is something that you can continue within your own organization, with your peers and in your own countries. And we hope you found this fruitful. Thank you very much.
Thank you.
Thank you very much.
Thank you. Bye-bye.
Thank you very much.
Thank you.
Bye.
Keep up the great work.